You feel like you don't matter, feel like your life doesn't matter, get involved.
Tēnā koe, Jean.
Tēnā koe, Pau.
Kaupapa au a tēnei mōku. It's this is a difficult issue for me to cope with, but cope I must, because of many things. But in sticking to the brief
Yes.
that you've just read to us, I'm looking at paragraph 8, where you mention a mother being told by Oranga Tamariki to get a lawyer. That seems so cold-hearted.
Yeah.
And this, I suspect, this mother would have been young.
Yes.
And have no business with getting lawyers, probably can't afford one anyway. How can Oranga Tamariki say these things to people that can't afford them and people who don't even know the world
Yes.
of lawyers
Yes.
and justice?
Yes. Thank you. I agree. If we look at the statistics, the women that are targeted are poor. The women that are overrepresented in Oranga Tamariki are women without resources. They are the women least likely to be able to respond to an allegation. They are the ones who have less whānau support. Often they are transient in relationships with partners who may not be as supportive as we would like, and the added burden of a concern by Oranga Tamariki and the advice to get a lawyer would be like telling her to go and stand on the moon.
Yes, yes. So they've actually done the research
Yes.
on the people that they are targeting, it sounds like.
I believe so, sir. I believe that they've had 5 generations to get it right. And what we're seeing are planned activities. The first Social Welfare Act was in 1925 to target vagrant children, and that act was brought upon by those who had studied other acts in Canada, so we adopted the same ones, but they still work against poor people, poor Maori people. Yes.
When I hear people like you talking about the DHB, the different DHBs, and talking about Oranga Tamariki, things become a bit of a blur for me. They begin to merge as one entity. Oranga Tamariki can't work without the cooperation, collaboration of DHB. How long has this collaboration been going in your research?
Yes.
Ms. TeHuia's?
It has been going on since the Crown Entities Act, and what has happened is emergence of government departments. Under the Crown Entities Act, we have education, police, health, housing, social welfare, all under one entity.
The point that I'm getting at, DHBs, I'm talking about hospitals.
Yes.
We're thinking about hospitals, places that you go to fix yourself up.
Yes.
It's a place that I've been visiting more often in the few months since COVID. And I'm getting a bit concerned about visiting such places.
Yes.
It's meant to fix me.
Yes.
And yet here they are, consigning Maori babies to
Yes,
separating them from their whakapapa.
yes.
Should I
Yes.
have that concern?
You definitely should. As well, there are studies to show that at a birth, a Maori baby is less likely to be resuscitated than a Pākehā baby. We have DHBs, which are majority employed white Pākehā middle-aged women whose benevolent ideas around motherhood and what is a right mother persists in DHBs across the country. If you were to also look at the senior management of most of the 21 DHBs, they are immigrant from overseas who lack the understanding of the rights of Māori, who lack the understanding of te reti, and impose their imperialist white views on our Māori people.
That is concerning. Thank you very much.
Thank you.
Tēnā koe.
Tēnā koe.
Kia ora.
I'd also just like to underscore the mahi to you for bringing this matter forward and to the attention not just of the tribunal, but to the country and the very public attention this has garnered. I'm very conscious that the brief we're talking about now was signed in the middle of last year.
Yes.
And since then, there has been this very, large amount of public attention to the situation.
Yes.
So my question to you is since the middle of last year, have you seen any reduction in this practice of PP uplift at hospital? And have you seen any change in the way it's happened, any change in the practice or the attitudes of Oranga Tamariki staff?
No, I have not seen changes at all. In fact, 2 weeks ago, a memo was sent out to 283 staff of the Hawke's Bay DHB elaborating on a referral guideline for mothers who are young, late attenders, previous Oranga Tamariki involvement, gang affiliation, not adhering to the rules, and the only word left out of that referral list was Māori. I complained to the DHB advising them that the list profiled Māori, that it was wrong, that they should not be continuing their behaviour, and I was advised that the document had gone past their management team and it had been okayed. Do I see a change? No, I do not see a change. I do not see an improvement. I do not see the work that Oranga Tamariki does and has been inspired to do reduce the harm and effect to Māori and hapu mama.
Can I just ask that referral guideline, is that for clinical staff referral to Oranga Tamariki?
Yes, it is. We have a copy of that attachment we filed as an attachment, and that was produced 2 weeks ago. Yes.
Thank you.
Kia ora anō, Ms. TeHuia's, just a couple of things to clarify.
Yes.
Is most of your practice been in Hawke's Bay in your 28, 29 years?
Yes, sir. I trained, when I left school, went straight to the Hastings Hospital and trained as a nurse.
All right.
Lived in a nurse's home, and when I became a freezing worker for 12 years, and when the freezing works was made redundant, I returned to do my midwifery and nursing and work in the community, which I've done since.
All
Yes,
right.
sir.
Kia ora. The discussion you've had with my colleagues around that example,
Yes.
and the process you're describing for referral from the DHB. Do you know whether that is the same for all DHBs, or do they all have their own different systems?
Can I tell you, sir, that if you go online and Google Oranga Tamariki referral notification today, you will see a referral guidelines for pregnant women who are non-attenders, late bookers, single parents, unwed mothers, gang affiliated, and it is on their website today. It is a national referral form which is used by people, and a study was done in 2017, and 84% of the notice of referrals to Oranga Tamariki came from employees of Crown entities, doctors, teachers, social workers, schools, healthcare workers, hospitals. Only 5.6% of the referrals to Oranga Tamariki came from family and whānau. When we talk about the nature of referral, sir, we continue to talk about a system that perpetuates itself.
That data you just mentioned,
Yes,
do you know what study that was from?
I've got the information. I can give it to you.
That would be helpful. Thank you,
Yes.
if you wouldn't mind, through your council.
Yes, I'll give it.
The multidisciplinary team that you talked about,
Yes.
can you just explain
So,
the parts of the team?
Yes.
Who's in that team?
so there are 21 DHBs. Each DHB has set up a multidisciplinary team. It is supposed to be multidisciplinary. It is white Pākehā disciplinary. It consists of social workers, kaya whina, Pākehā midwives, occasionally paediatricians, occasionally a queer or kaumātua.
So is it a requirement, you as a midwife or another health professional, for example, a nurse, are they obliged, and are you obliged to report in accordance with that format? So if you become aware of any of those particular factors, are the rules of operation meant to apply to you and to all health professionals that might come in contact with that mother?
There was a huge resistance by Maori midwives not to refer to them, so the government brought in a law, the Information Sharing Act, which now requires us to share information with them, and whether we are obliged to or not, we are now legally required to do so. Right. That law came in July 2019, Information Sharing Act. Prior to that, sir, we were half-heartedly required to refer only if we felt the need to refer. If we thought that we were, it was discretionary. If we believed that we were supporting the whānau, that they did not require the interference of a multidisciplinary team, then it was our professional judgment to care for that woman alone. Can I also say that if we fail to provide her sufficient support, and if something were to happen to her or her baby, we would be found negligent and liable, and our practicing certificate would be stripped from us. So we do not take on that responsibility lightly. Should we feel the need to refer our Māori hapu mama to a multidisciplinary team, then we can.
So that form, and
Yes.
I have seen it as appended, I think, to one of your briefs.
Yes.
Goes from the DHB to Oranga Tamariki.
It goes to all the 278 maternity, midwifery and child staff at the DHB and independent midwives in the Hawke's Bay community. It went out to 287 individuals.
Sorry, what I meant to ask
Yeah.
was, if one of the health professionals has cause to fill it out,
Yes.
where does it end up?
At the multidisciplinary team alongside a referral to Oranga Tamariki.
So it goes from the health professional
Yes.
to the DHB,
Yeah.
and in the example you gave us,
Yes.
you tried to complain to the DHB about what had happened.
Yes.
What do you understand, so what actually happened in that case? So it was Oranga Tamariki who ultimately came and uplifted the pepe,
Yes.
and they would have done so based on something like this notification
Yes.
from the DHB.
Yes.
Right.
Yep.
Do you know whether they had obtained a family court warrant?
No, they hadn't. And there had been no family group conference. There had been no meeting with the family.
So do you know what authority they're relying on to uplift the baby?
Self-imposed authority. If you read Peter Boschier's report, 2020, the Ombudsman's report, he states clearly that the actions and activity of the DHB in collusion with Oranga Tamariki is illegal. It is a breach of human rights and a breach of the rights of the mother and the baby.
All right. So this example we're just discussing, what year was that? Do you know?
Last year.
All right.